Sakthi Dental Clinic, Mullukurichi. A cap splint, also known as a crown splint or crown and bridge splint, is a dental appliance used to stabilize and protect a damaged or weakened tooth or teeth. It is a temporary restoration that provides support and protection until a permanent dental treatment can be performed. Here's some information about cap splints. 1. Purpose. A cap splint is typically used in cases where a tooth has been fractured, cracked, or severely damaged due to trauma or decay. It helps to hold the tooth fragments together and prevent further damage or displacement. The splint distributes the biting forces across the adjacent teeth, reducing stress on the affected tooth or teeth. 2. Construction. A cap splint is usually made of dental composite or acrylic material. It is custom made by a dentist to fit over the damaged tooth or teeth and adjacent teeth. The splint is bonded or cemented in place using dental adhesive or cement, providing stability and support to the weakened tooth structure. 3. Temporary solution. A cap splint is considered a temporary solution while the dentist determines the appropriate long-term treatment plan for the damaged tooth or teeth. It provides immediate stabilization and protection, allowing the patient to resume normal oral function and maintain proper tooth alignment until further dental treatment, such as a dental crown, bridge, or implant, can be performed. 4. Care and maintenance. It's important to follow the dentist's instructions for caring for a cap splint. This typically involves maintaining good oral hygiene practices, such as regular brushing and flossing, while being gentle around the splinted tooth. Avoiding sticky or hard foods that can put excessive stress on the splinted tooth is also recommended. Regular follow-up visits with the dentist will be necessary to monitor the condition of the splint and determine when it can be removed or replaced with a permanent restoration. 5. Professional removal. The cap splint is designed to be a temporary solution and will eventually need to be removed or replaced with a permanent restoration. This is typically done by the dentist once the tooth has healed sufficiently and a long-term treatment plan has been established. The removal process is usually straightforward and painless. Remember, the information provided here is a general overview of cap splints. The specific treatment and recommendations may vary depending on the individual case and the dentist's professional judgment. If you require a cap splint or have any concerns about your dental health, it's best to consult with a qualified dentist for an accurate diagnosis and appropriate treatment plan. Thanks for watching. Like and subscribe.